was fair skinned, my other two were lighter. My son had a baby in Mississippi, his first, and they wouldn't even let him in the room. They wouldn't let, he had dreads, and he told them, my mom was coming. He was on the phone. I'm telling you, you better watch out, my mama. They would not let him come in. And he had the baby in Lowndes County, and when I got there, he was in the room within 2 minutes. Because he said, when he walked in, he said, I told you. My mom was coming. So it shouldn't be that way. It shouldn't be that I have to go. Even here in Cahoma County, I had a family, I was out of town. They wouldn't let the mama or the father see their baby. She had birthed the baby. They said that she, and I was calling when on the way, and they said, she's hot, she's hot. What you mean she's hot? She got drugs in her system. I'm like, what drugs? It don't take a drug test to come back 2 days later. Come to find out she had nothing, but they was holding because she began to act erratic in the delivery room because she had the symptom eruption and they wouldn't talk to her. And she just wanted to know what was going on and why were they doing this to her. They just said, shut up and let us just save you. So it took me coming 2 days later for them to see their own baby. So these are what I'm talking about biases, laws, and procedures, and the care. He said he'd been to other countries, and I've been to other countries and here in the stores where there's midwives, where there's doulas, and those community people who are helping families, they have better outcomes. Because when someone who lives with you, works with you, and play with you, and is a part of your community, take care of you, they care about you. And you get better treatment. And access. A lot of our hospitals and a lot of our services are leaving out of the community. So a lot of our families don't have access. And I do love it what UMC is doing to provide emergency care to deliver the babies, but it still doesn't take that one-on-one care. Because ER is different than having personal care when you have a baby. So what I do at the diaper bank, our goal is to help families. Help families have access to the basic product needs that they need, along with the education that they need to be the best parent that they can be. So one of the things with providing access to products is we're helping with their mental health issue, because research has shown that when a family have diaper insecurity, maternal stress goes up. So think about a baby crying because their urine is eating at their skin. They have a diaper rash. And then a parent who can't supply it is worried about that. That's stressing me out right now. So that is our goal. And one of the things, since the diaper bank has been here in Cahoma County and the Delta region, Walmart, the local Walmart said that their loss prevention is down. I think that's amazing. Because families were still in basic need products, diapers and menstrual products. And now we provide this, and they don't have to steal it. Isn't that wonderful? Yes. One of the other things we do with Baby University is parenting education on how to take care of your baby before and after, and it's an 8-week intensive parenting class. And with that, we build community. Because I don't know everything. I'm gonna just tell them up front. I tell everybody up front, I don't know everything. But sometimes when families are sitting together around and we do a meal, we do a full course meal. When they're sitting around food, people talk. Just like one of the things we keep hearing in every class that we've had is that I thought I was alone and my child was the only one that did that. How many people have felt your kids were the only one? If they're not, the other one's doing the same thing. You just need someone to tell you that and to recognize and let you know it's okay. And that is so healing. And when we can heal people emotionally, spiritually, and physically, put it all together, a lot of time we come and we talk about the physical, but we forget the emotional and the spiritual. And when we can input that and provide and treat people as humans, then our outcomes will change. I'm Chelesa, Presley, and I'm sticking to that.